Action.
Good. Okay. How's it going? My name's Taylor. I'm the student PTA. I understand that 4 weeks ago you had an evaluation with the PT and just took some measurements, and today we're just going to be taking a reassessment of some of those measurements, seeing how those treatments have been doing in the last couple weeks, and seeing if there's any improvements or anything that we can be keeping our eye on. Any questions? Perfect. All right. So to start, I'm going to raise up this table, and if I could get you to remove your socks. Great. They look really cool.
I love my socks.
Oh, okay. Nice and high here. First thing we're going to be doing is taking a goniometer measurement of the external rotation of your hip. So if I could actually get you to lift up your leg and slide that under it. And so basically that movement is going to be bringing the inside of your leg into the middle. Yeah. So actually you can go ahead and spread that out. If you just want to go ahead and do it with this leg first, just so we can see, yeah. Okay, perfect. And then with this one. Awesome. Okay. And then try and not have any movement here, and go ahead and lead with your heel. Do you mind if I? Go ahead and relax. So that's all the movement that we're looking for. And it's a nice firm end feel. So for the measurement, I'm going to be lining it up. Midline of the patella, being parallel with the floor, and then this one will be following the midline of the tibia.
Honestly, Chris, you could probably just get on your hands and knees. Like, if it was uncomfortable, you wouldn't. Right.
And we've got a measurement of 26, where previously it was 20, so it's a 6-degree increase. Very nice. And so then while we're here, I'm going to be doing some muscle testing of it as well. Normally you'd be palpating for what muscles you'd be looking for, but since these are the deep 6, like the piriformis and so on, they're too deep to palpate. So instead I'm just going to have my hand up here and go ahead and bring it through your, just the range of motion. I'm going to bring it to about here. Okay, I'm going to press down. I don't want you to let me move you, okay? Awesome. Okay. Looks like that's improved as well.
I'm supposed to be one of the strongest people in the world.
Alright, well, still got some work to do. So, next, what we're going to be doing is I'm going to be testing your sensory. It looks like from our charts that you had a little bit of S1. It was just a little bit of a diminished sensation. So I'm just going to be doing some testing. Basically, this is all that feeling is going to feel like, and I just want you to let me know yes when you feel it, or can't tell if you think that you felt it but you're not sure.
Okay.
Okay? So if I can get you to close your eyes. You doing it?
Yes. 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 Yes.
Awesome. So, everything looks good. Okay. And so the last thing that we're going to be doing while we have you sitting is I'm going to be testing for your S1 and S2 reflexes by striking your Achilles tendon with the hammer, and basically you're going to have a little muscle twitch. So to do that, I'm just going to bring your foot up into slight extension. I'm going to try to avoid traction.
All the time.
if I could actually have you just go ahead and clench your arms together and just kind of pull out on them. It's called the Gendrasic. And I understand that he's had a little bit of surgeries and stuff in the past, so this side actually is more diminished than this case study. So, looks good for your average reflexes. And so the next step that we're going to be doing is I'm actually going to have you lay down flat on your back. So for this, what we're going to be doing is measuring hip flexion. So this leg, I actually don't like how low I put it. What we're going to be doing is finding the greater trochanter and lining it up with the lateral epicondyle and the midline of the trunk or body, and just going to be, so could I have you bending your knee, go ahead and bring your leg up to your chest as far as you can? Yeah. Awesome. You can actually, you could put that other leg up if you wanted to, or go ahead and do that again. Go ahead and flatten the leg actually. Yeah. Okay. So, let's see, we got it up. Go ahead and bring your leg out a little bit. Great trochanter. That. Grabbing this.
5 on, 5 off. But this one has 10 on.
It looks like we're at 139, or 138 degrees of flexion, which is quite improved since his last of 118 with pain. Did you have any pain in this? No. This one? All right. Yeah, like I said, that was a firm infeel. So the next measurement that we're going to be doing a manual muscle test on your abduction. Okay. Basically, so if I could get you on your side facing the wall. And what you can be doing with this is actually grabbing your knee with your hands. Go ahead and loop them.
This one?
Yeah, and then bring them to your chest like that. Okay. Yeah, and then leading with your heel, if I could just get you to kind of raise that. So, all right, action. If I could actually have you grab your knee. Yeah, and then leading with your heel, bring it up to the sky. All right, perfect. That's a 3 at least, and then bringing it out to about here. I'm palpating for the gluteus medius and minimus, and I'm just going to push down. I don't want you to let me push down, okay? All right, perfect. Sounds good. That's a 5, so that's an improvement as well. And then for the last bit of our reassessment, I'm going to actually be measuring your posture. So if you want to sit up, go ahead and watch yourself. Have you stand up next to this plum. Just have you facing me. Go ahead and line this up so you're standing about evenly. Okay. Looks like we still have a slight weight shift to the left. Could be due to the pain. Are you feeling any pain while standing, or maybe just because you're right-handed as well?
Right. I thought you were trying to get rid of it.
Yeah. Okay. If I could get you to face the wall.
Yeah.
Looks like lining up. It looks like he's still got a little bit of kyphosis and lordosis going. His head's still a little bit more forward. But definitely from the initial eval, it's getting better. If I could just get you to face backwards, maybe scoot just a tiny bit. Pretty good. It looks like the right scapula still a little bit protracted. But overall, a lot of improvements. So seems like our treatments are going really well, and we'll continue what we're doing and reassess in a couple more visits. So.
Did you guys turn yours in without your assessment?